I'm Toyosi Olutade, Toyosi Olutade. I'm the Chief Medical Officer at UnityPoint Trinity, and I'm also a practicing physician practicing as a hospitalist at UnityPoint Trinity.
What has been your role in at Trinity as far as combating the pandemic?
Yeah, this since March when this stuff really got on us. I've been serving as a chief medical officer. Actually got into my role as the pandemic rolled out. So it has been really to organize the medical staff and the provider response to help in battling this. Because aside from seeing patients at bedside, we needed strategies, we needed ideas, we needed to be able to work together in ways we've not. So as to combat this. So every day I'm part of the incident command. I'm part of the senior team, reaching out with and working with nurses, working with engineers, with environmental services, with everyone to ensure that we care for the patients the right way. Also working with the physicians to ensure that we have the right protocols, we have the right practice patterns in place, because this is a new disease. I wanted to make sure that we're giving the best care to the patients.
And what have the hours been like over these last few months?
The days of the week, I'm not sure what day of the week it is sometimes. Probably I get to know on some occasions. So. But yeah, the hours have morphed into days. You don't know what day of the week, because every day has been challenging. So in terms of hours per week, I cannot really quantify how much. But if my boss would ask me, I would say that I've been working just the hours I'm meant to work. But however, I know that I've been working way more than that. But it's for a good cause, because this is something that came on us unexpectedly, and we've affected the community so much so that we had to change the way we care for patients. And I and my colleagues are ready to do whatever it takes to combat this, and that's been our motto: to do whatever it takes and together. So it's been morning, afternoon, evening, weekends. We've all been communicating. Sometimes we take turns, but even then, it's been a teamwork.
Tell me about give me an example of one of the challenges you faced and how you guys have been trying to surmount it.
I mean, at the beginning of this, it was PPE, how does the virus spread? Our inventory for PPE was not sufficient, and what precautions do we really need to take? And those were questions. And then what treatment options do we have? So for the PPE, we was really working with everyone, all hands on deck. We were trying to source the right ones, and right now we're happy to say that there are almost 2 months of inventory available for our PPE. So, and that was taking us through the recent surge that we had. If we did not have that reserve, we wouldn't have been able to take care of the surge. Talking about treatment options is really trying to learn on your feet and learn from the experience of others as to what is happening, what is working, what not to do, and what to do. And but one of the biggest challenges, though, has been the toll is taken on our staff, and our medical staff, our nurse frontline staff, the emotional and physical toll. And so one of the ways we had to design ways on how to boost the morale of the team. That's why we have a celebration moment anytime someone leaves the hospital with discharged with COVID. That's why we have some mini team bonding moments. We've had a lot of help from the community, and more than that, we've just seen a lot of the physicians and the nursing staff ready to help. So we have a lot of people who have now come into the hospital space who say, no, we're ready to help. So we've been able to create teams of providers to ensure that burnout is turned into resilience rather than burnout. And so those are been the major challenges, and keeping up the spirit of the staff. Many times myself and my teammates and the senior team will go around to ensure that the staff are heard, they are taken care of. And those are the little things that matter. And you can see from today, the nurses have been critical in this journey. And how do we support and encourage the nurses has been one of our challenges. But there was nothing in the script that showed us how to do it. But we learned that when we put the people first, when we put the patients first, and we put our staff first, we'll be able to take care of this, and that's what we're doing.
Thank you.